One of the best things that I do is supporting clinical academic careers, and it really is the best thing you can do with a funding body. So I was on the Wellcome Clinical Interview Committee for 4 years, and I now have the great privilege of chairing the MRC Clinical Careers and Training Panel, which interviews for all fellowships right through from research training fellowships to senior fellowships. And I'm going to give you a quick overview about that, but where it says MRC, because some of these slides have been kindly given to me by the MRC, actually it's true for Wellcome Trust, NIHR, and many of the charity funding panels as well. So it applies to all of the good funders. Oh, that's the last slide, so let's try the other way. Yeah, okay. They're in a circle. So what I've said to a lot of you who are ACFs is that the measure of your success as an ACF will be getting onto the next point, which is to do a PhD. Generally, some people do MDs, but most people do PhDs, and we can talk about that if you want to. And so you should be thinking now, those of you who are ACFs, about how what you're doing at the minute will help you towards a nationally competitive fellowship application. And that's the thing to go for, because that's the best thing for you, it's the best thing for your supervisor, and it's the best thing for your institution. So that sets out the expectations and what the different entities are looking for. But also for funders, and this applies to MRC, Wellcome, NIHR, the funders want to fund the outstanding fellows. They want to help you present yourself as well as you can and to support people through the different points in the career track. And it's absolutely true that the funders very much value their fellows, and they do like to continue to support fellows. So if you've had a research training fellowship application with MRC or Wellcome, they would be very interested in you coming back for a future fellowship. So the MRC invests a substantial amount of money in careers and capacity building, not just for clinicians, but also for non-clinical careers. They also have a skills development fellowship process. But this gives you some idea of the total number of fellowships that are awarded to clinicians on an annual basis. And what sort of impact do these fellowships have on people's careers? So this is a study that was done taking the class of 1993, which might seem to you like prehistory, but it was sufficiently far out that one could look at the impact at least 10 years down the line. So around about 2/3 were in some kind of academic post, and quite a high proportion were professors, but others were in other academic roles. And just over 1/3 were NHS consultants. And that's not necessarily a failure. People change their minds. The important thing is that 85% were both clinically and research active. So and that the majority said that the fellowship had a significant or a very significant impact on their career. So that sounds like good value for money to me. So this is looking at the impact. Also, this is looking at clinician scientists, men and women, and comparing those who were awarded with those who were not awarded. Seems a bit tough, but actually there are substantial differences. I hope you can read that in that all the clinical professors in this cohort had come through from having been awarded a clinician scientist and so on. So a really substantial impact on future careers. That's clinician scientist. This is research training fellowship application. Again, there's quite a lot of data on the slides. So looking at men and women, comparing awarded with rejected. And again, if you're looking at those who ended up as an NHS consultant, rather more of the ones who were rejected went down that route. So the ones who were awarded research training fellowship applications clearly had we're kind of destined towards a more academic route, which is what one would hope for with that sort of investment. So research training fellowships, which I think a number of you in the room will be contemplating. This is as far as the MRC goes. I think it's similar for the other funders. So a limited amount of time can be spent on clinical work. I advise people not to do any clinical work during their PhD. We can talk about that. But sometimes if you need to do a clinic to recruit patients, it can be very much related to your research. And this is the sort of support that's provided. Now, some of you, and I've met one or two, did a PhD before your medical training or during your medical training. And again, at the same level, the MRC will welcome applications for research fellowships from you so that you can get back in to research. There's tons of information on the MRC website. There's short videos, there's how you prepare your proposal, how you prepare for interview, and so on. So use all of that. And I would echo what others have already said, which is that the funders are very happy to try and help you. And not many people take advantage of all that help. They're happy to deal with inquiries. They're happy to deal with whether the project would be in scope as far as they're able to. And so please do take advantage of the help that's offered. And I'm going to talk a lot about the 3 Ps. I presume you all know what the 3 Ps are: person, place, project. And then this is Clinician Scientist Fellowship and Senior Fellow. And again, if you look at Wellcome, you look at NIHR, there are equivalent schemes for those different stages in progression. So again, this is true for MRC, but I know that it's true for Wellcome and NIHR Fellows. There are networking opportunities. So just as this has been a great networking opportunity for paediatric trainees, you can meet other folk who are on a similar fellowship to your own, and feeling part of a cadre of people all focused on the same career path, all dealing with the same issues or similar issues and problems in your own particular environments, provides great peer support. And a feeling that you're not the only person dealing with this particular set of challenges. Flexible careers. So I hasn't escaped my notice that there are predominantly women in this room. I had an MRC fellow who was male who went down to 4 days a week when his wife had twins. So I'm very keen to support men who need to train flexibly as well. But I think we're increasingly aware that people in their mid-30s, it's a critical time to kind of make or break in terms of your academic career, but it's also the time that most people are having their children and have young families. And so we need to support our very talented academic workforce to continue in academic training whilst dealing with all of the issues related to family life. Okay, so the next section is going to be top tips for application writing. Now, what I've done is I've had a couple of people who've recently been successful with an MRC Research Training Fellowship application. I have cut and pasted bits of their application just for illustrative purposes with their permission. I'm not telling you their names, but if you know them, you might be able to work out who they are. But they have given me permission to do this. And I remember vividly when I was in Liverpool, probably 20 years ago, Alex Markham, who did the job that I'm doing now, came and gave a very droll lecture in Liverpool about how to write a fellowship application. He went through the form page by page and just told you how to write it. And I had a fellow who was applying at the time, and I wrote every single word that Alex said down, and we followed his instructions, and the fellowship was successful. So hopefully this will be helpful to you. So right idea, right funder. So Karen's talked about getting some experience of grant writing, and I think that's good, that's helpful. The single most important thing is that you have to present your ideas very clearly. The people reading your application don't have a lot of time. So if you can get across what you're trying to say in straightforward language, clearly, then you're on a winner as far as they're concerned. Because if they get it and they don't have to reread it 3 or 4 times, then they'll be less irritated. It's good to be on top of the literature, but nobody's expecting you to be an expert. Certainly at research training fellowship level, the people interviewing you will generally know at least as much about the field as you do. But much of what I'm saying is generic. It applies to fellowship applications at all levels. So start early. So, this is why I'm telling the ACF folk who may just be in their first year, think about your fellowship application in 2 years' time, or perhaps less, perhaps 18 months' time. Give yourself 2 bites at the cherry. If you're not successful the first time, half or the chances of success with resubmissions are about the same as the chances of success first time round. So it's worth thinking about going in again and learning from the feedback that you've already had. I don't know what it's like in your university, but in mine, our finance department seems to set earlier and earlier times that they have to check the costings and so on. So be very well prepared. There's lots of administrative stuff that has to be gone through before the application is allowed to be submitted. Okay, so I've said be clear. Obviously don't be boring. And it's really helpful to have pilot data. So if you're doing an ACF, generate your pilot data, because that gives people reassurance that you can do what you say you're going to do. And if you've contributed to some work that's been published, that's even better. So putting in a PDF, embedding it in your application of some experiments which have shown intriguing, promising results is very convincing. And write clearly for experts and non-experts. Most of the people around the table who will be scoring your proposal are not experts. So don't write it exclusively for an expert audience, and try and get feedback from people who've got a good track record with getting these awards. Okay, so this is where I start to show you some examples. So the 2 examples I've got, one was doing a project that was very much desk, epidemiological based, and the other one was doing work that's very lab based. So I thought the contrast would be quite good. So what is he in this case? So obviously he talks about his undergraduate degree, he got distinction, and he got first class honours. You'd be amazed the number of people that write that they got a BA or a BSc, but they don't actually write the class of the degree. And sometimes they don't write the class of the degree because it was a 2-2. So I always, as a panel member, would ask them that question. So we can discuss whether you should put down that you got a 2-2 or not, if that was the case. But I think it's important that that goes in. And then this just sets it out very clearly. So we've got an ACF, then they did an MSc where they got distinction, and then a first class BSc. So that's that make an impact on the first page. List the objectives. So I'm sorry this seems a bit wordy. So this is my colleague who was doing the laboratory-based project, and her objectives. So first of all, she talks about, it's a really impactful statement about how important the condition is that she's trying to study. So it's a form of epilepsy with devastating clinical consequences. So get that over in the first couple of sentences. And her objectives are very simple. She's first of all going to look at mutations of this gene within this particular group of patients. She's going to put it into cells. And the third objective, which I didn't have room to put, was she's going to put it into a mouse and study it in a mouse model. That's really clear, very straightforward. What about the other chap? Well, he chose to divide his objectives into academic and career development. That's fine as well. But the point is that it's clear, and they start off with a compelling statement. So in the UK, child and adolescent mortality is now higher than any other European country just about. So this is a disgraceful situation that we should all be bothered about. And then this is what he's going to do to try and understand it better. So clear message, and then set out a clear plan of how you're going to investigate it. Now, career intentions. So this is an absolute golden opportunity. So there is only one answer to that question. So whatever you think your career intentions might be, can I just tell you that when you write your application and when you go into your interview, you want to be a professor of paediatrics or whatever. No other answer is appropriate. Now, we're very British in this country, so we don't say, I want to be a professor of paediatrics. I would like to have a senior academic position within paediatric endocrinology. So that's code for I want to be a professor of paediatric endocrinology. And actually, what this chap did was, world-class clinical academic paediatrician. That's a professor. That's a very good professor. So that's code for that. And da-da-da. Now, the other young woman, I think she got it. If I was giving her some advice, I would have told her to put it in the first sentence, but it was there. My long-term career aim is to be an academic paediatric neurologist, especially. I think she gets it in somewhere. A launch pad to my academic career. So that's a bit wordy, and it comes in the middle of the paragraph. It needs to really be in the first line, and then the rest will flow from that. So then writing the summary. So as with writing a paper, I always tell people to write the abstract at the end, because it really has to distill everything that you've put in the paper, and that's the same here. So write it last. Absolutely make it understandable to researchers outside the field. But that doesn't mean for a lay abstract that you write it in really sort of noddy language, because that's patronising and frankly insulting and doesn't go down well. But, most of your committee, all of whom will be scoring your application, will not have read your full application. So you've got to get your main points across in the summary and in the bits that they will scan and read. So I hope you can read this. This is the application from the chap who was interested in child and adolescent mortality. So this is the lay summary, and this is the technical summary. So you can see how he gets across the burden or the importance of the problem that he's dealing with in somewhat different language for the lay summary here and the technical summary, but in no way is any of this patronising or, dumbed down. But it's explaining it, I think, very clearly, and clarity is extremely important. So the rate at which children die in the UK is higher than many other developed countries, and I want to know why this happens so that we can change policies in the UK to help improve the situation. And then he describes 1970s data and today's data. And then that gets translated into, for the more technical audience, there's a growing concern that mortality outcomes for children and young people in the UK have lagged behind that of other wealthy countries. And we now have the highest CYP mortality rate in Europe. And then a more technical explanation of how he's going to address that. So here we have lay summary here, and again she's interested in epilepsy presenting early in life, and she's couched that for a non-expert audience, but I think she's couched it in extremely appropriate language. And similarly, the technical summary, because I don't know about any of my other colleagues in the room, but I often go to the lay summary whenever I'm struggling to understand the technical summary in an area that's completely outside my field. So bear that in mind when you're writing your application. So then you will get, if you get to interview, and we're going to talk about that in a minute, you'll get your reviewers' comments, and sometimes you're asked to provide a written response, often not with a fellowship application. But really it's important to show respect for the people who are making the comments. It's very like providing a rebuttal in a paper. You don't trash the reviewers because generally they will be reviewing your rebuttal. Address the key areas of concern. But don't be surprised when you get to interview if your panel don't ask you anything about the reviewer's comments. We often take peer review comments with a little bit of a pinch of salt. Sometimes they're wildly enthusiastic and very superficial and don't really get to the kind of the bones of the problems of the project or the potential problems. And sometimes they're very picky and completely over-focused on one small part of the application. And so I think all good panel members will read the proposal very, very carefully and reach their own conclusions, which may be somewhat different from the reviewers. So the reviews help, but they're not the dominant aspect. Well, this is pretty self-evident. Methodology increasingly these days has to be very robust, and certainly MRC have expanded how they ask about data handling. They expect you to have good statistical defence of the numbers that you want to include and so on. So really do make sure that you've had good help with the methods part of your proposal. And these are all the sorts of places that you can go to. But I would really strongly get people to read it. If people ask me to read their applications, even though it's completely outside my field, I can at least look at the other aspects of the form, apart from the project, and also give them feedback on how they've written the summary or how they've written the objectives. It's really important. Okay, so hands up everybody who's kind of through their PhD or towards the end of their PhD and thinking about next steps. Wow, that's about half of you. Thank you very much. So I've got about 4 or 5 slides here on Clinician Scientist Awards, for which in Welcome would be intermediate awards. So this, first of all, is looking at this time frame, is what specialties. And you'll be delighted to see that paediatrics is well up there with 3 of the Clinician Scientist Awards and doing very well compared to other big adult-based specialties. So this is looking at the sort of person that's successful. So what's changed during the course of the time that I've been supporting people for clinician scientists is that people are more and more senior. So this is duration between CCT and CSF start, and so very few were pre-CCT. When I started supporting people, the majority of people were pre-CCT, so that has changed. But not very post-CCT. So you should be thinking about this around the time that you'll be getting your CCT. And then a career break, so that's people going on maternity leave is the most frequent reason, not the only reason. And you'll be pleased to see that that's the case, and also people taking time out to do clinical work as well. So this is looking at outputs. So I don't hold much stock by number of publications. It's more the quality of publications, but I think it tells you something. About 10 original papers, 8 first author, and 5 first author original. That's pretty good. But that was the mean. This looks at grants held. Again, Karen said starter grant. Any of you who's a clinical lecturer, you must apply for a starter grant. I used to sit on the panel for that. No discussion. You absolutely must. It's set up for you, but it has to be good. It's only 30 grand, or it may have gone up now, but it's rigorously reviewed and very, very high assessment. But it really sets you up. Okay. The environment, so these are the universities that were hosting the CSF, the Clinician Scientist Fellowships in these particular years. And actually, interestingly, most people stayed in the same place. So I think the old mantra that you have to move, you have to, I think because we've got such a high female workforce who can't necessarily up sticks and go to the other end of the country, people are much more sympathetic to you staying in your own institution. Oops. Okay. And then, but if you do ask for opportunities to go abroad, so Paul McNamara went to Perth for a year on an intermediate fellowship and took his 4 children with him and his wife. That can be costed and funded by the funders. And again, person, place, project. This is, mother and apple pie, but it applies to a CSF the same as it does to a research training fellowship, the same as it does to a senior fellowship. Think about these aspects. A lot of weight goes in the project. If you haven't got a good project, you will struggle. Even if you've got, every single prize at medical school and first-class degree and distinction and so on, if your project won't stand up, then you're in trouble. So really do think about it carefully, and do think about how you develop it and getting the right sort of input, and not making it too ambitious. So a lot of people put in all sorts of stuff that they think they're going to do because they think that'll impress the panel. And I have seen a number of panellists just say to candidates, this is just much too ambitious to do in 3 years as a PhD. So you have to really be ready for that. Okay, so that was a quick rattle through. So I'll take any quick questions now about that, and then Karen and I will do a bit of a double act.